Let's talk about birth prep. So, we want to think about how we can prep our pelvic floor and our whole body for birth. But let's think about our pelvic floor. Our vagina, our pelvic floor goes through massive changes during pregnancy and birth. And how can we reduce the impact of those life events on it? So, the first thing I would say is we really want to learn the difference between tensing our pelvic floor and relaxing our pelvic floor. So, you will probably be told during pregnancy that pelvic floor exercises are really important and they can reduce the risk of pelvic floor dysfunction postpartum, which is very true. So, continuing pelvic floor exercises throughout your pregnancy can be really important. And if you want to know how to do pelvic floor exercises, then I would go back to our pelvic floor basics video to have a look at that. Whilst pelvic floor exercises are extremely important during pregnancy, pelvic floor relaxation is as important. And that is because during birth, our pelvic floor has to relax. So, how do we learn what relaxation of the pelvic floor looks like? When we are thinking about trying to relax our pelvic floor, it is often associated with breathing techniques. So, whilst you are pregnant, it can be really difficult to feel that kind of rib expansion because baby's pushing up into the diaphragm. And finding a comfortable position to try this in can be helpful. But we want to think about feeling a deep breath in and how that feels when our pelvic floor might lengthen. So, what happens is when we take a deep breath in, our diaphragm descends and that allows our pelvic floor to move down slightly. It's a very subtle movement, but learning what that relaxation of the pelvic floor feels like can be really important. So, I would be thinking about trying some breathing techniques where you're really tuning in to the movement, the subtle movement of your pelvic floor. So, deep breathing into the sides of your rib cage, feeling lengthening of your pelvic floor there. So, my first tip would be thinking about how it feels to relax and lengthen your pelvic floor with your breathing. I think often women are looking for this huge movement of their pelvic floor, and it's very, very subtle. And it should just feel like a little push down of the pelvic floor very gently and then a recoil inside. So, breathing exercises like that, where you're really tuning into your pelvic floor, would be a great place to start. Other things are thinking about how our pelvic floor or what positions our pelvic floor can lengthen in. I really like to get my pregnant patients on a birthing ball or using a birthing ball. And particularly when we are thinking about birth prep, this can be because you can put your arms onto the birthing ball, which gets some of the pressure out of your pelvis from baby and allows you to feel a bit more of what is going on in your pelvic floor there. Things like rocking backwards and forwards into child's pose can be really helpful. Sitting on the ball and getting your hips moving, pelvic tilting backwards and forwards, side to side can be really helpful. And the other thing to think about is things in all fours, particularly where we turn our knees inwards. When we turn our knees inwards, that allows the back of the pelvic floor round here to lengthen. If my thigh bones turn inwards, the back of the pelvic floor lengthens. So, thinking about those sort of positions and then adding breathing on top of that can be really helpful to understand how it feels to get our pelvic floor to lengthen. So, breathing and stretches. What else should we be doing? Now, there is some bodies of evidence that support the use of perineal massage. Perineal massage shouldn't be started later into your pregnancy. That's at around 37 weeks, and I would always be guided by your midwife as to when you or if you should start that. But what is perineal massage? The perineum is the gap between the vagina and the back passage, which stretches during delivery. So, what do we do with perineal massage? We want to stretch this area here. So, using some sort of oil like a coconut oil or an olive oil, or there are particular branded ones, particularly for this exercise, is to stretch that area down and round. Because of how awkward it can be to get to that area, you might want to think about using your two thumbs and thinking about pushing down to 6 o'clock and stretching down and round between 6 and 9 o'clock and 3 o'clock. So, pushing down and round and stretching that area can be helpful. Again, I think that really needs to be supported by pillows or either one foot up on a stool, but stretching that area down and round can be really, really helpful as a birth prep exercise. So, the main things I would be thinking about are breathing techniques where you're learning to kind of tune into your pelvic floor and see what it does, and trying to feel that reflexive movement of your pelvic floor in breath. Thinking about some nice stretches for your pelvic floor, and we can always send these out to you separately when you're watching this video. And finally, thinking about perineal massage can be really helpful as well.